I was born on July 1, 1818 in Taban, a suburb of Buda, Hungary. My family of German ethnicity ran a successful grocery store. I was one of 10 children and enjoyed a comfortable upbringing.
Ignaz received a solid education, first at a Catholic grammar school, then at a Piarist college. Young Ignaz excelled in his studies, showing an early aptitude for the sciences.
Ignaz, you should study law. It is a respectable and lucrative profession.
I enrolled at the University of Pest in 1837 to study law as my father wished. However, I found myself drawn to medicine. This fascination led me to switch my field of study after just 1 year.
Semmelweis transferred to the University of Vienna in 1838 to pursue his newfound passion. The University of Vienna at the time was a renowned center of medical education. Here, Semmelweis immersed himself in his studies, attending lectures by prominent physicians and gaining practical experience in the city's hospitals.
Medicine is a noble field, Semmelweis. It requires dedication and an unyielding quest for knowledge.
Semmelweis graduated with a degree in medicine in 1844. He then specialized in obstetrics, a field that would become his life's work and ultimately his legacy. After completing his studies, Semmelweis took a position at the Vienna General Hospital's first obstetrical clinic. This clinic was renowned throughout Europe. However, it harbored a dark secret, a tragically high maternal mortality rate.
I was shocked by the number of women dying from a mysterious illness known as childbed fever or puerperal fever. It was heartbreaking to see so many young mothers succumbing to this disease shortly after giving birth. This illness, characterized by fever, chills, severe abdominal pain, and often death, was rampant in maternity wards across Europe. The symptoms would start suddenly and progress rapidly, leaving little time for intervention. The Vienna General Hospital's first obstetrical clinic had a particularly high mortality rate, sometimes exceeding 30%. This was an alarming statistic that could not be ignored. I was deeply troubled by this and became determined to discover the cause of this deadly disease and find a way to prevent it. I knew that understanding the root of the problem was the first step towards saving countless lives.
This clinic was divided into 2 separate wards, each with its own staff and practices. One was staffed by male doctors and medical students who were often busy with multiple duties and responsibilities. The other was staffed by midwives who were primarily focused on the care of pregnant women and childbirth. Semmelweis observed a striking difference in mortality rates between the 2 wards. This discrepancy was both intriguing and concerning. The ward staffed by doctors had a significantly higher rate of childbed fever than the ward staffed by midwives. This stark contrast raised many questions about the practices and hygiene standards in each ward. This observation puzzled him, and he set out to find an explanation. He meticulously examined the procedures, cleanliness, and interactions in both wards, hoping to uncover the hidden cause of the deadly fever. Semmelweis meticulously analyzed all the possible factors that could be contributing to the difference in mortality rates. He looked at birthing positions, ventilation, and even the presence of priests administering last rites. He painstakingly ruled out each factor one by one.
Then, a tragic event provided a crucial clue. My close friend and colleague Jakub Kolečka died after contracting an infection from a scalpel cut during an autopsy.
The symptoms of Kolečka's illness closely resembled those of childbed fever. This led Semmelweis to a groundbreaking hypothesis.
I proposed that cadaverous particles from the autopsies were being transferred to the patients in the doctor's ward. The doctors often moved directly from the autopsy room to the maternity ward without washing their hands.
Semmelweis immediately implemented a strict hand-washing policy in the doctor's ward, a move that was revolutionary for its time. He mandated that all medical personnel wash their hands with a chlorinated lime solution before examining patients, a practice that was unheard of in the medical community.
This solution is known to neutralize the smell of decaying organic matter, which was a common issue in hospitals at the time.
The results were dramatic and immediate. The mortality rate in the doctor's ward plummeted, falling to levels comparable to the midwife's ward. Semmelweis was elated and felt vindicated. He believed he had found the key to preventing childbed fever, a deadly condition that had plagued hospitals for years.
This is it. This is the breakthrough we've been waiting for. We can save so many lives. This discovery could change the face of medicine forever.
However, his findings were met with resistance and skepticism from the medical community, who were not ready to accept such a radical change. Many doctors were offended by the suggestion that their hands were unclean and could be spreading disease, a notion that challenged their professional pride. This is preposterous. How can our hands be the cause of disease? Our hands are not the cause of disease. This idea is simply too outrageous to be true. They clung to the prevailing theory of miasma, which attributed diseases to foul air, a concept that had been widely accepted for centuries. They dismissed Semmelweis's ideas as radical and unfounded, unwilling to believe that something as simple as hand-washing could make such a difference. It's the foul air, not our hands. This theory of hand-washing is just too radical to be true. This is just too radical to be true. We cannot accept such a drastic change without more evidence. Despite the resistance, Semmelweis tirelessly advocated for his hand-washing protocol. He faced immense opposition from his peers who were deeply entrenched in traditional practices. He presented his findings at medical conferences, published articles, and wrote letters to prominent physicians. His dedication to spreading the word was unwavering, even in the face of skepticism and outright hostility.
Hand-washing is crucial to saving the lives of mothers. We must adopt this practice. It is a simple, yet effective measure that can prevent countless deaths.
He passionately argued that hand-washing was crucial to saving the lives of mothers. His voice echoed through the halls of medical institutions, urging his colleagues to see the undeniable truth. He even conducted further experiments to support his theory. These experiments consistently demonstrated the life-saving potential of hand-washing.
The outcomes are clear. Women treated by doctors who wash their hands have a significantly lower mortality rate. The data speaks for itself, yet it is met with resistance.
The results consistently showed a lower mortality rate among the former group. This was a breakthrough that could not be ignored. Despite the mounting evidence, the medical establishment remained largely unconvinced. They clung to outdated beliefs and practices, unwilling to change. They found it difficult to accept that something as simple as hand-washing could have such a profound impact. The simplicity of the solution was its greatest strength and its greatest obstacle.
How can they not see? This simple act can save countless lives. It is a small change with a monumental impact.
They found it difficult to accept that something as simple as hand-washing could have such a profound impact. Yet Semmelweis's determination never wavered, and his legacy continues to save lives to this day.
The lack of acceptance of my ideas took a toll on me. I became increasingly frustrated and isolated. I alienated colleagues with my persistent and often confrontational advocacy. My mental health deteriorated, and I exhibited signs of what is now recognized as obsessive-compulsive disorder.
In 1865, at the age of 47, Semmelweis suffered a mental breakdown. He was admitted to an asylum in Vienna. There he was tragically misdiagnosed and subjected to brutal treatments. He died just 2 weeks later on August 13, 1865, from a wound on his hand that had become infected. The irony of his death from sepsis, the very condition he dedicated his life to fighting, is both poignant and tragic.
Semmelweis's groundbreaking work went largely unrecognized during his lifetime. However, his ideas gained significant traction in the years following his death. The development of germ theory by Louis Pasteur and Robert Koch in the late 19th century provided the scientific basis for Semmelweis's observations. The medical community finally began to understand the crucial importance of hand hygiene in preventing the spread of infection. Semmelweis's work, once dismissed and ridiculed, was finally recognized as a cornerstone of modern medicine. Today, Ignaz Semmelweis is hailed as the savior of mothers. His pioneering work revolutionized hospital hygiene and paved the way for the widespread adoption of antiseptic practices. His insistence on hand washing as a means to prevent the spread of disease is now a fundamental principle of healthcare. It is a testament to the power of observation, critical thinking, and unwavering dedication to scientific truth. Semmelweis's legacy is a reminder of the importance of challenging dogma and advocating for what is right, even in the face of adversity.
Ignaz Semmelweis's life was a testament to the power of one man's dedication to saving lives. His unwavering belief in his discovery, despite facing ridicule and rejection, paved the way for a revolution in healthcare. His legacy is written in the countless lives saved by the simple act of hand-washing. Semmelweis's story serves as a timeless reminder. Sometimes the simplest solutions are the most profound. He's a true hero of medicine whose unwavering pursuit of truth continues to protect mothers and their newborns today.